This meeting started. All right, first we need approval of the minutes of September 23rd. Could I get a motion to approve those? Member Daly and second by Member Duncan. Any corrections or additions? Okay, please vote. Who are we waiting on? Member Elsasser. He's an aye. Okay, thank you. Next, we'll go to informational items, and first we have the Board of Health. Welcome, Monica.
Good afternoon. I know we have a pretty heavy agenda today with the budget, but I did want to, as for the Board of Health update, give a little bit of an update regarding our WIC program. As many of you are aware, starting on Saturday with continued federal shutdown, SNAP benefits will no longer go into play in November. So that benefit will be stopping here as we enter into November. WIC is a federal pass-through program to states. Illinois has assured us that they have funding through November. But we do also recognize that with the changes to SNAP, we should also expect a volume increase to our WIC program. Just to give you a little bit of background around WIC, we see close to 3,300 is our caseload. It is a nutrition program. It's for women, infant, and children. So we work with pregnant women and postpartum for 1 year, and then children from 0 to 5. There are 7 priority areas for the WIC program. And so we do expect, if the federal shutdown does continue past November, that what we will be looking at will primarily be reassessing which priority groups that we would be seeing. So we would most likely maybe focus on priority number 1, which is pregnant women, postpartum, and then infants. And all of this is nutritional risk. So we primarily look at infants that, due to hemoglobin levels or nutritional or growth charts, are not meeting marks, we'll be focusing on them. And again, just to give perspective, that's about half of our caseload. So it is about 1,500 is roughly what we see just for priority 1. Our staff understands kind of the process, as well as our Board of Health. And so there's already discussions about how to supplement depending on any type of changes that come with the different buckets of money. And just as a reminder, there are really 3 buckets of money that we access when it comes to WIC. 2 come from the USDA. That's primarily for the administration of the program, as well as the food fund, so the money that goes to families. In Illinois, we spend $5 million for WIC, just in the food funds alone per month. And then the second part of it is related to our rebates we receive through the formula program, which go directly to the state. And so based on those 2 types of dollars, as well as USDA's release of their contingency funds, Illinois is comfortable, and WIC is open all through November. After that, depending on whether we have a full federal budget or a continuing resolution, we'll make adjustments accordingly. But I know it's been on the news a lot, especially SNAP. And SNAP, while a different program than WIC, they do interconnect. And so I'm more than happy to answer any questions.
Yes, Member Allison.
When you say focusing on infants with vulnerabilities, what does that mean as far as focusing on them?
So because our program offers various types of levels of educational assistance and nutritional assistance, we would be prioritizing those clients to come in. And maybe also food packages are being prioritized to families where you have infants that are nutritionally insecure or not meeting their growth charts, as well as pregnant women and postpartum that are at high risk. So it'd be really focusing on those individuals. And then again, it can go up to age 5. So if you have 5-year-olds on the program, which is fantastic to have older children on the program or up to 5, if you have them on the program, and they're nutritionally stable and they're hitting their growth marks, we might be doing general interventions with them, just keeping them touched, making them aware of other benefits in the community. But we'd be focusing all of our resources on providing for those at the highest nutritional risk.
Thank you. Member Blair.
Do you have a communication strategy to make sure that the public is aware that WIC is, at least for right now, still open?
So we do. We actually have a really strong Illinois-based WIC association. So if you look at our social media, especially the way we were able to contact through the iWIC program, which is our software system that works with families, we have been pushing targeted messages. I will say, though, it is an uphill battle because the national conversation is that there is a federal shutdown and that all federal programs are closed, as well as the news about SNAP. And a lot of people confuse the two as being one and the same. And so it is an uphill battle, but I think we've been doing communication every day on our social and then talking to our clients and making sure they understand with their reminder appointments that, yes, we're operational coming up here in November.
Thank you. Any other questions? Okay.
EMA?
EMA.
Okay. So in your packet is the October monthly report from the EMA. Jason wanted specifically to highlight under miscellaneous that he was actually working with the University of Illinois Springfield and the state of Illinois tariff impact on emergency management. And so that was kind of a new avenue that you don't see a lot of EMAs, but there's a lot of concern about how does that play out in our EMA program. A little bit more, again, I brought this up at the Board of Health meeting, and Betty was there. Everyone said I was the most depressing conversationalist that day. Our EMPG grant, which is our emergency management program grant, the city has approved. We were under the coverage that we will not receive. The federal government was going to cut the EMPG grants, and the states would have to look for other funding. I know that working with the city of Peoria, they've allocated funds in their budget to cover their portion of the EMA. And I know working with Heather and Scott, Heather's also done the same here for the county. We did hear that EMPG will be coming back from the federal funding, so that's good news. However, due to the federal shutdown, we actually have no line in sight for it right now. So we're still operating without a budget, and the EMPG grants the EMA work is already underway. So hopefully, again, with this continuing resolution or CR or the opening of the federal government, we'll be able to start moving that program forward as well.
Okay, any questions on EMA? All right, thank you. Next, we have the Regional Office of Education. Good afternoon.
Good afternoon. Just a couple items that you have there in front of you, and then Kara isn't here, and so I'll have a little bit of an update for truancy. I know we had several conversations leading into us, one, getting a grant for truancy, but the numbers weren't quite released yet. Those came out about 10 days ago, maybe a little bit longer. And so that first item there that we sent to you is we got about 290,000. We have several colleagues across the state that got considerably less. In fact, they were operating 650,000 a year over the last 3 years, and they were cut down to 120,000. And so we wrote a pretty solid grant. And of course, that money is going to be used to offset the commitment that you made through intergovernmental agreement for services. And we've been working through that with fifth floor here with admin. Since I'm on truancy, we'll talk about it just really quickly. what we're finding is our case numbers are a little bit lower than usual. And we think it's because of the success that we had in the previous year. And so there's not as many kids that are sort of lingering from year to year as we're getting them through our exit criteria, providing them services. And so we have about 200 exits so far, which is good. We would anticipate with the weather turning cold that will prevent some kids from going to school. And so we think our caseloads will certainly go up. But we've actually had 200 that exited the program to this point with 1,400 visits, 780 calls, texts and emails, communications with parents. And then the team went to an international conference in Memphis. And what they're finding actually is that as they're talking about the work that they're doing, people are asking how they're getting it done, because we're having well above average success than most truancy programs. And I think anytime you go to any situation where you're talking about how do you beat the odds in general, it's about leadership and it's about the people doing the work. And so we happen to have a great team here. We also were talking a little bit about our alternative learning opportunities programs. That's where we're going to seat essentially an adult in a building working with a caseload of at-risk youth. And we've gotten commitments from in principal, they have a process to get through the boards. But in principal with 9 districts, we think we're going to have a 10th one come on board. I met with their board last night. And so the hope there that with the addition of those 10 new employees for the ROE, as you can see there on number 3 is that we're up to 75 total staff, which is a considerable number of staff with services that we're rolling out into the county every day. And then the only other thing I want to say here is we want to mention Tom Zimmerman. He's our grant coordinator. He has been fantastic and integral with the TAB grant and finding us Department of Homeland Security grant. They're working on a Department of Justice grant to continue safety services, but we had a little bit of a lull, and there was a grant out there for the coroner's office and medical examiners, and so I sort of sent it to them, and they have attempted in the past to write for that grant unsuccessfully, and so I said, let you borrow Tom here because he's really good at his job. And I said it has to be fast because his last day for us is actually Friday. He took a great job down in Tallahassee, Florida, where his best friend lives and his son goes to school. So he's super excited to move, which is disappointing for us because he's done such great work. But I said, just make sure you get that grant done before you get out the door. So he's been great. He's been absolutely wonderful for us. So.
That's great. Any questions? Yes, Member Allison.
Who's going to fill the void of having a great grant writer that knows what they're doing?
Yeah, that's a great question. And I know it'll probably be a theme that you sort of hear is that we're a little bit worried about the cuts at the federal level, in particular how it will typically manifest here in Illinois. And so we decided we're sort of taking a step back with hiring as folks leave until we find out about the ALOPs to make sure that there's funding. We will drop into the evidence-based funding model, which is how all schools are funded, except there's no money in year 1. If they do flat funding in year 2, then because we didn't get any money the year before, we won't get any money in year 2 either. And so we're sort of taking a step back and waiting. So Jennifer's going to handle, because she does everything, she's going to handle all the financial pieces. The actual searching and writing of grants will go back to our individual teams, and then we'll work together with them to make sure that those get done in a timely manner, and we can put our best foot forward. But yeah, it's this is our 4th or 5th person. We lost our Department of Homeland Security grant, but kept him on. We lost ESSER funds that were clawed back, but we kept our math coach on. And at some point, the burden will be too much for the office that we'll actually have to start theoretically, after just talking about expanding to 75 people, that we might have to make some tough decisions.
Thank you. Any other questions? Okay, thanks. Next, we have sustainability. Hello, Becca.
Good afternoon. I just have some quick updates on numbers of the collections that have been going on this month. So the last household hazardous waste collection that was hosted by GFL, there were in a series of 3, was held on October 4th, and that yielded 73,934 pounds of hazardous waste, which brought the total for all 3 to 172,000, a little over 172,000. Keeping in mind they were required to collect 150,000 pounds per the landfill agreement. We anticipate that to be not calendar year, but 12 months. So we'll work with GFL to see if they'll kind of keep this as sort of a road show, traveling around to reach the different areas of the county to do this hazardous waste collection, or if eventually it will land at the transfer station. So that is a discussion that is yet to move forward. But nonetheless, they met the amount. That same day also held a county-sponsored Consumer Electronics Recycling Act collection at Limestone Township, and that yielded 16,961 pounds of electronics. So that was great. And then also we have two coming, one that just happened last weekend on the 25th in partnership with Timber Township, where a number of those people said, we just went to Limestone. So we opened it up to a few more people and did some targeted publicity to get a few more people in there. And that worked out well. We filled the box truck that we had, which was great. I don't have the numbers on that yet, but guessing around 5,000 pounds or so. And then there's another this weekend in Brimfield in partnership with Rosefield Township. And these events were really a chance for us to sort of reach out to those other areas of the county that maybe have been a little bit underserved in working with township government. So looking forward to that. Next, Recycle Coach, I'm just going to jump down to that section. I did present at the Circularity Conference, which was a joint conference of a couple of the professional organizations for solid waste management officials in the state and the Recycling Foundation together. I presented with both the city's education campaign and also the landfill committee's consultant. On Recycle Coach, our launch, what the reports look like to other county officials so they could learn what that looks like and what they can yield from it. Also talked to Tim in terms of moving our education campaigns forward. Now that people are using Recycle Coach, we can see what questions they're failing on the quiz, which ones they're getting right. We can see what they're searching, which items they're looking for disposal on. So that helps us to sort of target our education. So really excited about that. Township Supervisors Group met. Next one is January 14th. I believe before I told you that it was going to be Veterans Assistance Commission, we did push them back to January because we had a full meeting at the beginning of October. Landfill Committee meets tomorrow. Guessing that's going to be a little less frequent, maybe quarterly moving forward. So we'll update you after this committee. Regional Food Council continues to meet every other month. And then a couple of sustainability updates. Highway construction should begin for the solar array. The permit application and everything is with planning and zoning. And so we anticipate that starting just any day. Stuff is on site. I do have a new employee starting Monday. Very excited about that. Her name is Rachel. And then I also wanted to provide a really quick update on the United Way campaign that's ongoing. We're hoping to have contributor forms in by this Friday, the 31st. We did a couple auctions. The health department did their own, and then there was also a county auction, 2 chili cook-offs, one at HHS and one sponsored by the clerk's office here. We just with those events and a few donations through a couple coffee events that were actually team Peoria County events. We're at $2,500 from those, not considering employee donations through form or direct donations. And I think that's it. I was kind of all over the board, but unless there are questions.
Do we plan on doing the recycled lights again this year? I mean, by this time next month, people will be getting their lights out of the attic and realizing they're not working.
We do. So we'll be rolling that out. I anticipate all of our same partners are going to be on board. I just need to make sure with the new staff person won't have any trouble with collecting those lights. Last year it was a little bit tricky to get to all the places to collect the lights responsibly, or as frequently as they would like to have them collected. But yeah, that's an ongoing program. And then also Christmas tree drop off with Department of Natural Resources will also be promoted this month. Well, in
Any other,
December for January.
any other questions? Maybe next month after the landfill committee meets, whether it's yourself or Member Williams or somebody from landfill, if we could maybe just get more comprehensive update as to where we are with the landfill itself. I know we had issues with the mine survey, if that's been rectified, where we are as far as the projection, our long-term plan of opening landfill 3. It'd just be nice to get an update of where we're at. We haven't heard much since the contract's been put into place, so.
Will do.
Okay, thank you. All right, next, we have no resolutions, but we do have a committee action, and that would be the budget. So can I get a motion to put the budget on the floor? Member Williams, and a second by Member Blair. Okay, Heather, it's all yours.
All right, thank you.
Megan, would you switch to screen, please?
Okay. Before you today is the recommended budget for the County Health Committee. Our overall budget recommendation is for $64.2 million out of the general fund, of which $1.2 million is planned use of fund balance reserves to match the $64.2 million in expenditures. And then for all funds, it's $172.5 million in revenues, with $18 million of that being planned use of fund balance reserves and $172.5 million in expenditures. For the County Health Committee specifically, on all the departments and funds that roll up to that, revenues recommended at $9,766,132 and expenditures at $10,415,660. County Health Committee departments are 6.33% over overall budgeted revenues and 6.04% of expenses. This chart shows you revenue changes and expenditure changes over the past several years. They're broken out, color-coded by the different categories of revenues and expenditures. For sources specifically, sources will decrease or projected to decrease about $1 million next year, or 9.8%. This is mainly due to a decrease at the health department in epidemiology, dental clinic, and WIC. Also a decrease in PPRT. We're seeing that consistent across all PPRT budgeted accounts. And then grant funding at the Solid Waste Management Fund we received in 2025 is not anticipated to be received in 2026. And then the Regional Office of Education funding, the revenue, we consistently gotten $19,000 a year in revenue from that, with an offset in expenses, and those have both been moved off of the county's funded portion of ROE to the ROE's other revenue sources. For uses, we anticipate a decrease $1.9 million in expenditures, or 15.2%. This is mainly in contracts and services, with the corresponding decrease in revenues at the health department. The expenses also decrease. And then the Care and Treatment Board is significantly decreasing their granting awards. And next year is planned. They had planned to draw down their fund balance reserve right to fund balance policy, and they are right at that mark for fiscal 26. So I believe they have been communicating that to agencies for quite some time. to anticipate that. Staffing in the County Health Committee decreases 10.26 FTE in fiscal 26. These were all positions in the health department. 4 were actually vacated in fiscal 24 and the balance in fiscal 25. So they will not be budgeted in 2026. Positions included several dental clinic assistants, a disease specialist, community health program manager, clinic assistant, and a child and family health assistant. Some of these had duties that were absorbed by other current positions, and others were just like the dental clinic. It's now run by OSF, so that's why those positions were eliminated. And finally, personnel expenses for the County Health Committee. This is the change over from fiscal 25 to 26, and then dating back to fiscal 22. Happy to answer any questions you may have.
To start off, if anybody has any questions directed to the ROE, he needs to leave fairly soon, so if we could take those first.
Oh.
Yes, Member Daly.
Could you explain the chart with the percentages? The green and red. Yeah, yes. I think it has something to do with attendance,
Is it
truancy.
in his report? It'd be
Yeah.
in your report in the packet, not budget.
Oh,
Peoria put that out.
Did that one?
That's way to sort of track whether looking at that correctly from this number of kids that actually meet the criteria for that. Yeah, kids that are in red or kids that aren't meeting appropriate attendance levels for us, which is so I'm looking at it, seeing it, kids that are meeting, the kids that are during that week.
okay.
I just wanted to, after you look at it closely, there's like three rows for one school, for the same school, or another has about 5 rows for the same school. So that's what we're trying to understand. Each one is an individual student.
Would you mind coming to the microphone, please? That's okay.
In this case, it's when you look down and you see Glen Oak, for instance, and why Glen Oak has so many, is because at that school they have a disproportionate number of kids that are chronically truant. And so that's one of our schools, which is.
So Glen Oak has 43. So Glen Oak at the top says it has 43 referrals. We just want to make sure we understand.
So referrals versus number of chronic truants. So referrals might be what we're getting in from administration and or secretary, whoever's handling that. And then oftentimes what it is we've got these larger banks of kids that like Elmwood, for instance, doesn't have very many on their list, and so that's why it only has this sort of one column. It has really what is nobody at this point at Elmwood, but those are the percentages of attendance for those kids in those
individual
schools.
students. So
Yeah.
when we see all those rows of Glen Oak, that's like 21 students is what we're looking at.
Yes.
Okay.
Sorry.
The 43
Compared to 43 referrals, right?
Yes.
Okay.
That's the number of kids we have on there right now. Then the
Okay.
number of referrals comes in as we're getting them weekly, sometimes daily now.
So you get the referrals. I'm sorry, just to clarify, you get the referrals, but these are the ones that are on the caseload.
Yes.
Here. Okay.
Yeah.
Okay.
Yeah, that's why you're seeing these percentages of actual attendance. And so when you see it below 80, that's when it turns red.
Okay.
So green is anybody who is above 80% attendance. And then again, you can see how we're tracking them in 2-week increments by the top column. And so Obviously, Glen Oak has a large number right now of students, and so that's why you see quite a few more there. And then you can see that last column where it says average.
Uh-huh.
So you can see that over the last, in this case, we have 6 cycles because that's where we're at sort of in the year.
We just was trying to make sure that these were individual students, or why was this?
Oh,
why
yeah,
was
I'm
this-
sorry. Individual
Why were the
students
schools
tracking
listed
their
multiple
actual
times?
Right.
Okay, that was all. Thank you.
Sorry, it was confusing to you there.
Thanks.
On Health 7 there's a table of graduate, oh my gosh, I can't speak. Graduation rates? Did I say it right? Okay. It was sounding really wrong in my head. When do you anticipate like the work you've been doing with truancy affecting the rates?
Oh, yeah, for sure. I mean, what we know, the research will tell you if a kid isn't in school, then that kid isn't able to typically be successful. There are a handful of students that sometimes don't need to go to school and they're just fine, but that is not the norm. And so not only that, but the reason that we're starting the ALOT programs for a similar purpose is that to make sure kids are in school, to make sure that they have the skills necessary to be successful. And obviously, the more they're there, the more they're able to take advantage of any of the number of other services that are also in schools, including meals and other social services. And so there's no doubt a kid almost always has to go to school in order to be successful. So we would anticipate graduation rates to go up. And again, as a reason we start the ALOT program, because we want to catch kids early and be able to help them develop the skills early before they sort of fell into the high school realm, which sometimes is a sink or swim situation, depending on what school they're at.
Any other questions, budget related to the ROE before he leaves? Okay, thank you. Okay, now how about any other budget questions in general for the Health Committee? Member Daley.
I noticed that in personnel for the health department that we decreased by 10 employees, but it only saved us $99,000. I don't understand that.
I can try to address that and
Go ahead.
then have Monica follow up. So there were about $606,000 in savings from the salaries for those positions. The part of that offset is due to salary adjustments that were made during the collective bargaining agreement negotiations for other staff to get them up to market rate, and then I don't believe that all of those positions were probably reflected in the fiscal 25 budget because 4 of them left in fiscal 24. So those savings would have been realized in this year. And then the health insurance expenses went up 9.1% on average. So that explains part of the difference there.
The other thing to add too is when you're looking at our budget in terms of, I discussed this with Chair Renaud about this as well. We had a Senate appropriation from Senator Duckworth's office for Department of Justice for a youth courts opportunity. Because that was not budget in 25, which we subcontract to the courts, we actually moved personnel from our budget into a contractual for that project with the courts. And so the percentage difference is against the revised, but if you look at against the adopted, our actual decrease, instead of being a 2% savings, was actually closer to 6%. And so, kind of accounting for that 10% reduction. And then, as Heather mentioned, all those facets of what goes into personnel. Additionally, the start of this collective bargaining agreement, the first year, as part of our merit, the county general fund supported the first year of merit, but then moving forward, it was placed back onto the health department. So we do budget up to $1,000 per staff as part of that collective bargaining agreement.
Well, I guess so actually we did not eliminate 10 FTEs. because 4 people had already left.
So they remained in the FTE headcount until are removed. It's FTE is kind of complicated. It shouldn't be, but it is. So a lot of times, so when you have vacancies, for example, you may still have the headcount in, but you can shift those funds to other line items if necessary, or and not fill those positions, but they still remain as a headcount in your department until they're officially removed from the budget book, essentially, at this point in the process. So I don't know if I could speak to the 4 for 20.
So in 2024, the positions included individuals that retired or left the agency, but we put on hold generally because we didn't know as we were moving into 2025, the new building, what the differentiation would be. And so that included our community health program manager, one of our social workers that were part-time because of a collaboration we had with Heartland Health Services, and knowing that in 2024, we'd be starting part of 2025 with that same partnership until we move fully into the building. And then similar with a dental assistant that we had that actually transitioned because of the elimination of their position into one of our clinical assistants based on the collective bargaining agreement's ability to bump. And so those positions, they were in 2024 because of the small amount of time in 2025 where we overlapped between our temporary locations and our new facility. We had them budgeted, but we knew that they were going to be eliminated and cleaned up in this cycle, along with the dental clinic, which carried over for the first month and a half of 2025.
I also recall that before we built the new health campus, that you said that the efficiency of the building should allow you to reduce your staff count. But we are still quite a bit, not quite a bit, but several ahead of where that staff count was before COVID. And so I'm assuming as time goes on, by attrition, that a staff count will go down because of the efficiencies of the building.
So our clinical assistants, we did do a reduction. So we do have a larger reduction in our clinic assistant program. However, from 2019 pre-COVID to 2026, we also saw some of our grants change requirements. So a good example would be our lead, or Illinois Department of Public Health lead program. The threshold for lead dropped from 5 down to 3.5, which actually increased our caseload for lead. So we actually had to make sure we had enough environmental health lead inspectors as well as RNs to facilitate the increased volume that we saw on that caseload with that transition down. Additionally, our HUD grant, we did receive a new HUD grant. It was more of a multi-year that allowed us to actually bring in a designated lead risk kind of technician to support that program. So again, we saw that where some of our grants, based on changes in our grant deliverables, required us to change our staffing needs. Additionally, WIC would be the other one. In WIC, they require specialized breastfeeding peer counselors and breastfeeding support. And so we created nutritionist 2 positions to meet those grant requirements of the WIC grant. So in our, especially in our front line, we saw the most efficiencies, which was the intake area. We did see reductions in that workforce, not as drastic because in other program areas, grants, depending on threshold changes in lead or new requirements, had us have to increase staffing models in there. The net is still a reduction, though.
And like always, if the grants go away, the positions have to go as well.
Yes, and also being grant funded, it's also reimbursement based. So another thing to note about our grants and how we budget is we do budget 100% of our staff the full year. And so again, if we have staff, we then do receive the revenue. If we don't have staff in that position, we're not able to receive that revenue because we're not able to render those services because our grants are reimbursement based.
Okay, thank you. Any other questions for the health department while Monica's here?
I also have Brian Belly, who
And
is
Brian,
our director of finance. You can also ask him multiple questions if you want as well.
Seems like you're holding your own just fine.
Uh,
Any other questions on the health committee budget as a whole?
a comment, maybe?
Sure.
I know I spoke to the chair regarding the facilities transition that we've been moving forward with and working closely with CFO McCord. All of the expenses that the health department and the health fund department fund is looking for the right word here, required to have for moving forward that transition is built in our expenses. We do recognize that you kind of see the FTE sitting in one spot, utilities in another. And that's purely a timing reason based on getting the feedback for the transition and when the budget book had to be published. Heather felt that it was best to make sure the expenses were lined up. But then once the budget has been approved by the county board, maybe working later to actually bring that all together into having a facilities transition fee or transaction fee, similar to our IT fee and our fleet. So it's very clear as to what the health department is responsible for in regard to the facilities aspect. It'd be a clear transfer back into general revenue for that.
So with the previous building, the health department was responsible for everything in that building. But now that they're a tenant within the building, I believe it's 68% of the building is occupied by the health department. So they pay 68% of the expenses associated with the building. So that'll be spelled out maybe more clearly next cycle. So, all right, any other questions? I believe Member Williams has something to bring up.
Thank you, Mr. Chairman. At yesterday's infrastructure budget, we made an amendment to move $250,000 from the Hannah City Work Camp in the capital budget. And so just to make this all clean, I want to make an amendment to add $500,000 from reserves for abatement and remediation to the buildings at Hannah City Work Camp, and that will come from the Solid Waste Fund.
Could I get a second on that motion? Member Daly? Does anybody have any questions? Okay, first we'll vote on the amendment to the budget. Go, please vote. Okay, that's unanimous. And then now we'll vote on the budget as amended. Please vote. And that is unanimous. Okay. Next, we're on to miscellaneous. Public comment. I may have gotten those backwards. I'm going off my memory here. I just want to take a minute to thank our finance department and for all the work on the budget, and Minister Sorrell for answering questions, Monica for answering my questions. I appreciate working with us all. So thank you. We're adjourned.